Hello. All right. So first, we wanted to do just another land acknowledgement. So we respectfully acknowledge that the Corner program, formerly known as Boys R Us, and this presentation were created and are being facilitated on the traditional, ancestral, unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. And before we start, we also wanted to acknowledge that Ashley and I here are speaking as service providers for this presentation and not as sex work experiential folk, even though that is our topic. And our topic is promoting mental health and enhancing belonging within specifically the male, two-spirit, trans, and non-binary sex worker community using a participatory approach. So my name's Gwen Lister, this is Ashley Dreger, and Richard, who is the program coordinator. He's been the program coordinator for 18 years. Could not make it. He was ill and he sends his regrets. So we will do our best to take over his slides that he was going to present on. If we do it poorly, it's his fault for being sick, okay? If we do it well, it's because we're so awesome. Okay. And then just a little bit about us. So we are health promotion case managers out of AIDS Vancouver. And basically what we do is we are out on the streets every day and we're in community every day, meeting with people one-on-one and also presenting like groups and education about health promotion. So people have already mentioned what health promotion is, but basically it's we're working with people to improve their physical health and their mental health. And because we're with AIDS Vancouver, it's mostly to prevent HIV, so the people that we work with are at higher risk for HIV. And so that's just a little bit about us. We're social workers by trade, not used to presenting, but really happy to be here. And yeah, we're just a little bit more hood, I think. This is the nicest clothes that I've worn probably in 6 months. Usually used to hoodies, so. And I think, yeah, I'll let you go now. Your turn.
So we just wanted to start by noting the marginalization that sex workers experience. In the sex worker industry, there still tends to be an assumption of a cis female worker. And most sex worker support services are not inclusive of queer, male-identified, or male-bodied sex workers. So this adds just to the numerous barriers that sex workers have in accessing health services. It's often influenced by a misunderstanding and an oversimplification of their lives and experiences. So many sex workers are experiencing higher risk for numerous physical and mental health concerns because of the barriers that I've already mentioned and the ones that are sort of listed here as well. Mental health in particular among sex workers is a serious concern. But research is showing that a safe, supportive community environment with appropriate and applicable programming can mitigate these risks and greatly improve mental health outcomes for these individuals. And that is where the program that we work with comes in. So the program is called The Corner. When it started in 1997, it was called Boys R Us. At that time, Street Youth Services, the Urban Native Youth Clinic, AIDS Vancouver, and Positive Living Society had partnered together to start a program specifically for male and trans sex workers. And the first participants were primarily street workers in Yaletown. Today, so the demographics of our community, today the ages range from 18 to 63. The age is increasing, the average age is increasing because participants are aging with the program, so we're seeing sort of an increase in that. Between 15 and 20% of our participants identify as gender diverse. No? Oh, wait. Yep, sorry about that, there we go. Between 15 and 20% of our participants identify as gender diverse, and almost half of our participants self-identify as Aboriginal. So people are coming to the program for a variety of reasons, dependent on their needs, and sometimes just the challenges they're experiencing sort of in that moment or in that time of their lives. But it also largely serves as a safe community space where they connect with staff, volunteers, each other, and they are coming regularly to receive those kind of services, but also just to be part of the community there.
So originally, the primary purpose of the program was really HIV prevention, and also helping people living with HIV to access services and treatment. So remember, this was starting in 1997, so that was just really a huge issue and a huge need in that community. It still is a huge need, but we're kind of shifting to some other primary purposes, so that's still included within the primary purpose of the program, but we're also adding some of these other things. So really focusing on connecting individuals to be able to access services. And these are people who have had some really difficult and stigmatizing interactions with healthcare workers and community organizations, and so really helping them to feel comfortable talking to people and find providers that will work with them and treat them with respect. And then, like Ashley already said, is just building a sense of community, and we're really focusing on promoting the mental health and increasing resilience among this community. So this program recently went through a redesign. So there were a few reasons for the redesign that took place. So we wanted to kind of renew and revamp the purpose. So we wanted to ensure a continued safety and focus on like sex work and sex workers or people with previous sex work experience. So we wanted to kind of increase the safety and anonymity that people could expect. We also wanted to increase programming, and this was based on participants identifying these needs and wants, and promoting self-sufficiency, and then promoting physical and mental health. And so cost was really becoming an issue. As we all know, budgeting is difficult, and we were getting 50 to 60 participants per night, 3 nights a week. And feeding a full meal to these people was kind of starting to become unsustainable. And so even though the program has a really rich history, there's never really been any ability to count individuals and create stats in order to get alternative funding for this. And then so cost was an issue, and then also timing. So the Corner is a Vancouver Coastal Health program. The strategy for the Downtown Eastside community engagement kind of changed, and even though we're not located in the Downtown Eastside, most of our participants are either living in or accessing other services in the Downtown Eastside, so we were involved in that kind of redesign that was happening. And also Three Bridges Community Health Clinic was relocating, and that's where the primary drop-in center was located. So that was all happening kind of at once, so those were the reasons behind the redesign. So just kind of some things that we were keeping in mind when we were planning for change. So we created a planning committee of, so Richard, who'd been program coordinating for 18 years, brings a really rich history of experience in his position, and kind of is like a walking history book of the program. And so that was part of it. I was brought in to help with like program planning, just because that's some things that I've done in the past, is build like clinical programming. And we also worked with the Health Initiative for Men and the Hustle program, as they've been a huge part of the community as well. And what we really focused on is we wanted to focus on staying low barrier. So we wanted people to be able to come and access services without having to fill out a huge intake form or being turned away for whatever reasons. And we wanted to use a social justice model, so we're allowing people to identify how they identify. We're not, some people use different methods for making sure the right people are in the right space, and we're kind of using a model that says if this community meets your needs, then you deserve to be here. And we accept you, and then a participatory approach. So we got an advisory board together of long-term participants who'd been with the program, some of them since it began. to really inform and help lead us through kind of building the program. So that was a really awesome and important part, and they kind of went through everything, every step with us to say yes, okay, or no, that needs to be changed. And so I'll just go through this quickly, but you can read this. It's just our process and strategy. So we collaborated with similar community organizations. We wanted to see, not reinvent the wheel, but see what they were doing that was working and pull from them. So some examples would be PACE and Insight. And we found new program space, and we vetted it among the participants for safety and anonymity to make sure that they would feel safe in those spaces. We developed some new intake processes. I'm a social worker, that's intake process, but really it's just, let's gather some stats about the people who are entering our space so that we can know more about them and what they need and actually serve, do more than just provide people with food. Let's provide with services as well. And then education workshops, peer-led, and facilitated groups, and also cultural programming. As Ashley said, huge First Nations, Indigenous population among our folk. And then, so just some successes. So we're in the 5th month of implementing these new changes, so it's still relatively new, but we're really excited about it. It's been going well. So we relocated to our new space without any pause in services and without losing our base community. So we were able to relocate, and people followed us, which if anyone works in community services, that's huge. So we really had no real lapse, maybe a couple of weeks for people to figure out when it was at Three Bridges and when it was, at AIDS Vancouver at the other location, and what days to go and what times, but really that was the only barrier to that, so that was awesome. We implemented these new participant information forums so that we could know more about what our people needed, and the cool thing is that no one had any issues with that. They all came in. They report that it helped them feel like they were like kind of a member coming in, and that we were really truly interested in what they had to say and what they were going through. And then we crowdsourced a new name and a logo. So the corner is not as gendered, which is very helpful since so many of our people are gender diverse. And then also we have a new logo, and I forgot it at home, but it's really cool. And we didn't have it approved by the time that we did these slides, so that's my only bummer, but it's cool. And so right now we're doing workshops on a weekly basis. We have peer-led activities. We're doing groups, and we've had a counselor available, and we also do a grocery program. So some other qualitative success, I think that everyone, peers, staff, volunteers have all seen participant engagement grow. So instead of grabbing some food and taking off, people are really staying for the full length of the drop-in, chatting with their friends, chatting with us, talking to us and to other service providers, and engaging in things that we have going on. And then people have reported feeling much safer in the new environment. So with change came more anonymity, and that has helped people. And then people are also requesting that we keep a photo of them on file in case of emergency. So it's just letting us know that sex work in Vancouver is still dangerous, and people are still going missing on a regular basis, and they felt comfortable enough to let us help with that. So that's kind of nice. And then our first stats are some really preliminary stats, but this is really interesting to know that 80% reported needing assistance with either mental health, counseling, or loneliness. And so that's what our people are really accessing the program for. We still do serve food and meals every once in a while, but it's really making sense that most of our people are coming because of the connections that they're making. And you can see these other stats listed as well. And I'll just say, I think it was in the past slide, but our attendance numbers are up to 154, and our attendance is showing that 80% of that 150 are attending like more than 25% of the days that we're open. So this is a service that people are utilizing really on a weekly, monthly basis. So.
So just to wrap up, these are some of the things that we're just doing moving forward. Gwen's mentioned a couple of them already. We're really just focused on staying participant-centered, participant-driven. Like we mentioned, we are just there to really try to facilitate a space for the participants to create what happens. Some of those things are listed here. One of the cool things we're doing that I think Gwen kind of mentioned, but around peer-led groups, or participants are creating and facilitating their own groups depending on what their interests and talents are. We've seen a real excitement around that. We're doing a lot more programming around mental and physical health concerns, and we're just having great involvement. I think, if you've led groups, sometimes there can be a little bit of lack of participation, but we have not seen that. Here at the corner, it's been so impressive, the amount of people that are really eager to attend the groups or the conversations and to participate in them. That's just really been very exciting. And yeah, so we're just excited that the impact the program has had and just to see where it's headed. Thanks so much.